No, I'm actually not sure why I'm here today.
Oh, okay. Well, you're here because you're getting a liver biopsy.
Why am I getting a liver biopsy?
Well, you're going to have a liver biopsy today because...
During orientation phase, nurse helps patient recognize and understand his or her problem and determine his or her need for help.
Hello, Mr. B. Do you know who your doctor is today?
No, I'm not sure who my doctor is today. Are you going to be my nurse today?
Yes, I'm going to be your RN and your doctor is going to be Dr. Smith. So how are you feeling about your illness?
I'm okay. I'm just a little concerned about my LFT levels in the labs.
Okay, well actually I've been looking at your labs this morning and it looks like you're doing a lot better. You seem to be improving day by day. I suggest that in order to continue to do better, that you should make sure that you exercise. You should take walks around the floor at least once every 4 hours and just watch your diet. And I think as long as you do that, you'll continue to improve.
Okay.
In identification phase, the patient identifies who can help. The nurse permits exploration of feelings to aid patient in undergoing illness as experience that reorients feelings and strengthens positive forces in personality and provides needed satisfaction.
Hello, Mr. B. So now that we've established why you're here, we're going to start to go over your meds. Do you know which meds you're taking and why?
No, I'm not sure what meds I'm taking and why I'm taking them.
Okay, well our new goal is going to be for you to learn your meds. We're going to start with these.
Okay.
During exploitation phase, the nurse can project new goals to be achieved through personal effort and power shifts from nurse to patient as patient delays gratification to achieve the newly formed goals.
Thank you for going ahead and going over my medication for me. I have a better understanding of it now.
Well, I'm glad that you understand why you're taking your meds. Now when you go home, you'll be able to be independent with your own care.
In the resolution phase, the patient gradually puts aside old goals and adopts new goals. The patient also frees himself or herself from identification with the nurse.
Hello, Mr. B. My name is Peplau, and I'm going to be your nurse today.
Because the nurse and the patient are strangers, it is important that the nurse treat the patient with common courtesy.
Hello, Mr. B. So your labs are in this morning, and it looks like your potassium is a little high.
What does that mean?
Well, this means...
The nurse provides specific answers to questions, especially concerning health information.
So, because I know that this patient learns through visual aids, I'm going to teach him about his medication with the use of my manual.
There are two components of the teaching role, instructional and experiential.
Hello, Mr. B. So I think that you should go on a walk today.
No, I don't feel good.
Okay, I know that you don't feel well, but I think it's really important that you take a walk. If you don't feel like walking now, how about in an hour?
Okay, that sounds good.
The nurse acts as a leader to promote cooperation and active participation.
Thank you, nurse, for everything you've done. You remind me of my daughter sometimes.
Yes, I do have a lot of similarities to your daughter, but...
In the surrogate role, the nurse helps the patient recognize similarities between the nurse and the person recalled by the patient. But the nurse also helps the patient recognize some differences between the nurse's role and that of the recalled person. As a counselor, the nurse responds to the patient's demands.